Welcome back to MTP, Meet the Penis. This is number 8. We just returned from Boston where Dr. Munarez and Coloplast hosted a clinical concepts of prosthetics. It was fantastic. I realize I'm getting older because I was the oldest guy there at Proctor Wise. But it was an amazing experience in that we had great participants and great proctors, and there was a lot of excellent banter back and forth between those that are supposedly teaching and those that are supposedly learning. I think it went both ways. So this being our number 8, there's a ton of great questions. There's a few things I want to address directly. Next week, I'm going to go after a topic that keeps getting pounded, and the topic I've reviewed on my site, PeritoUrology.com, many times, and that's what you will lose length and girth-wise when you're impotent, and we'll talk about that in detail next week with some animations that are going to be exciting. This week, we're not going to do that. We're going to try to address a couple of questions that I find fascinating, and I want to start with Larry. And Larry basically says, will I ever be able to have an erection again on my own with the implant? Now, the reason that you will be getting an implant, if you do, Larry, is because you're impotent, because you don't have erections. My colleagues, most of my colleagues do a study called the duplex, which will show why you are have erectile dysfunction, and that you are indeed suffering from organic, not psychological impotence. So the thought that you would have your own erection again is not appropriate, considering the fact that you don't have erections. Now, that being said, will you get that feeling of tumescence around your implant? Absolutely. And most of our guys, especially our younger guys, will tell you that once the implant is in place, they start to feel that erotic feeling of that ongoing tumescence when your libido is up. So yes, indeed, you will have some of your own blood flow, and depending upon how the implant is done, we have found that those who don't serially dilate, which you'd have to go back and look at all of our procedures, but those who don't serially dilate tend to be more sensate. So there's certain things that we do to try to maintain as much of that tumescent feeling that I think you're trying to talk to me about. Are there things that you can do to enhance blood flow once the implant is in place? Of course. Many of our patients do use PDE5 inhibitors, in other words, Viagra, Cialis, all those products to get more girth in the glands and tumescence in the glands as well as the urethra. Some patients will opt for what's called a trimix gel, which is an off-label use of a gel that will also give you tumescence in these areas. But understand that those of us that put these things in, we don't put them in because you're potent. We put them in because you're impotent. Dale, I don't know if you're a urologist or a patient or both, but you did ask that they said, you prefer, I prefer the infrapubic approach. How do I avoid the neurovascular bundle? And those are the words that Dale used. There's nerves that run along the top of the penis, which give you sensation in the phallus and glands of the penis. The dorsal nerve complex, neurovascular bundle that he's referring to, just runs along the top of the penis. There has never been a publication talking about a neural injury secondary to an infrapubic approach for penile implantation. That being said, there are anecdotal stories. They usually go back to the days of the first guys, the pioneers in implants. And those guys, if you remember, the infection rates were very high back then because we didn't have these hydrophilic coatings that we have right now. And yeah, I can see getting lost in that situation from the infrapubic, meaning from the top approach. But using our approach, we don't cut the penis, we don't cut the scrotum, and we have yet to have one neural injury. That being said, I'm sure there will be one along the way. We're now in the 8,000, 9,000, wherever we are. But Anybody that's doing an infrapubic approach these days usually takes precautions, and the precautions that we recommend are you use what's called a hydrodilation at the beginning of the case, so the penis is very full and you have plenty of area to work away from that neurovascular bundle that sits in the middle. And I can tell you that all of the younger guys and girls that are coming out that are involved in sexual medicine know where that neurovascular bundle is, and you're not going to have a problem if you go somewhere to have an infrapubic approach done. Now, Joaquin, Mike, Amanda, she was on a list also, asking about the big question that we hear over and over again. If you go to my site, peritourology.com, you can submit your questions. You can also look at my statement probably 5 years ago on what happens to a penis once rendered impotent, and we're going to talk about it next week, and we're going to show you some animations, and some of these animations actually worked on some of my colleagues who tend to disagree about the atrophy that is experienced with impotence. So I think next week's going to be really exciting. I hope I addressed, Dale and Larry, and then Joaquin, Mike, Amanda, and the many others that are all talking about the same thing, which is size. We'll talk about that next week. We're gonna also address some things that are going on in the fields of penile cosmetics over the course of the next few weeks. So please stay tuned to Meet the Penis, and we will see you next time.